Just remember, some of you have seen this slide before, that expressive approaches really, I always say they're body-based. It's the only form of psychotherapy that's really action-oriented too, in the sense of focusing on the nonverbal kinds of doing, rather than the brain activity, which is fine. Talking is certainly has resolved a lot of problems, but we're the ones that kind of carry this other piece in our work. So, it's about these basic kind of phenomenon in that sense of rhythm, movement, synchrony, being together and interacting in the same way, in the same rhythm, in the same movement, and even in the same heartbeat, which is entrainment, and breathing. But there are these other three pieces, and there's a fourth one too, that Elizabeth will talk quite a bit about. And they come from sensory integration. I keep saying that because I want to honor the fact that occupational therapy and things that are related to that really brought us these different kinds of ways of sensing our body and isolating that and working with that. And they're interoception, exteroception, and proprioception. So I'm just going to go over those. About today. So we've got these three feedback systems that we can work with. There's exteroception that refers to the sensory experience of the environment. So, basically our five senses: ears, nose, tongue, skin, eyes, what we're seeing, what we're hearing, etc. And that's facilitated by the brain for the most part, and our body senses what's going on, smells around us right now, whatever we're seeing, whatever we're hearing in the environment. And we can focus on certain things, and if we have the ability to shift, we can shift away from that exteroception as well. That's something, you might be working with the person that you might be seeing in a session. Proprioception is sensory feedback about where your body is in space as related to gravity, because gravity exists. We're all controlled by gravity, where our body is in space as well. This awareness also includes knowing, how you're sitting right now, if you're leaning to one side, maintaining balance while standing or walking. But trauma affects that sometimes. And I'll give a good example of that in a second here. That's a first person example from myself. Interoception is something, I've said this before, is big in trauma work right now, and helping people become safely aware of their sensory experience in their internal body. So there's a lot of things that are really common all day long, which most of us notice when we're hungry. I need more coffee. I feel my heart rate go up and down. I sense my breathing has changed, all those kinds of things. But a lot of times traumatized people don't even sense those. They may not sense that their body's anxious, or their body is withdrawn, or their body has a certain internal sense in the moment. So that's one of the things we're working with. So these are the three sensory feedback systems that create really the sense of ourself and the foundations of body awareness. So they're just important to know, to think about, because this is what's going on with us all the time when we're thinking about this term embodiment. How are we embodying the experience of what's around us, what's inside us, and what our internal sensory experience is, and how we communicate those senses. So these are the three ways that you can be. And I put on here the time of pandemic because we're in it still. And we can be in one or more of these responses during this time period. But anytime we're traumatized or under stress, in the throes of traumatic stress, we can go three ways with this. Generally, if we're under a lot of stress, most of us, unless we're very good at bouncing back and resilient, the optimal thing would be to seek connection and social support of others. So maybe most of us can do that, but it may not be our first response. So this is the social engagement system that manifests in us this sense of safety. And mostly it's about connection, right? So I always say during the pandemic. Now, this has been a little bit compromised by the fact that we have to physically distance. We don't have all the connections that we normally have because of safety issues, because of needing to stay away from each other during this time period. Then you can have an activated response, which is results in mobilizing. And mobilizing doesn't mean just running. It also means responding to a sense of danger in other ways. Like one of the things, I always go back to this, when the pandemic first came on, I did a lot of house cleaning. I was cleaning everything, like the virus was all over the house. Well, it wasn't all over the house, but it was a way to mobilize and feel like I was doing something and empowering myself when we were in this state of danger and not knowing what was going to happen with this unseen kind of terrorist that was out there, which is the virus. So sometimes, we take on a lot of projects to keep our minds busy if we're traumatized, or we try to control the environment somehow. So that's the more activated response. So we see these in people and we see them in ourselves. And as I said, we can go through all these three. We can be more in one than another, but we may be bouncing back between some of these also, between socially engaging, being anxious, or going into the other one, which is collapse, which is an immobilization through anything from, with the pandemic, some people ended up watching TV, Netflix constantly, to ignoring things. Some people, I don't think most people are doing this now, but in the beginning of the pandemic, some people just try to ignore it and it'll just go away. We had a leader in our country in the US who said, it'll be a miracle. Someday it'll just be gone. That was a perfect example of giving in and immobilizing and not wanting to do anything about what was happening in the world. So there's those three things that we can look for, and when we're interacting with somebody, working with them, help them think through, or help both of you find out where someone is in these responses. This can be part of the whole configuration for trauma reactions. Even if somebody has not had an injury, it might be part of that. So, sometimes we have people that come in and say, this kind of clothing just bothers my skin, or I can't wear something that's too tight, or I need to have it, be a certain tightness because it helps calm me down. They get overstimulated, they get hyperactive from a lot of things that are environmental. So we don't really know why sensory defensiveness comes about, but it's something I ask people about. If there's things like certain tactile things, there's certain fabric, or a certain experience or a certain smell that might create this sense of like, I'm really anxious now. I feel very defended in this environment and I don't know why. So those are these exteroceptive things that create this defensiveness that can cause strange feelings inside, so interoception, and strange sensations with where your body is in space and how comfortable or uncomfortable it is. I hope that makes sense, because I think it's pretty important, because we deal with the senses in expressive arts. So we probably can contact or manifest this more in people to help them understand or to process it. I think more than, people can talk to you about this, right? But if they're moving or hearing things or making things, touching things, smelling things, all that comes with working with expressive arts. We're tapping a lot of these things a lot more directly. So I think that's an important piece.